We are back! That's right, we are back. This is the Ethnic Health Disparities podcast and this is show number 6. That's right, show number 6. And we are analyzing health disparities reports number 2. That's right, analyzing health disparities reports number 2. And I am Dr. B. I am your host for the Ethnic Health Disparities podcast show. Wow. Well, again, this feeds into is connected to show number 5, and we're just getting started in analyzing, breaking down the data. That's what's necessary now. And I have the Center for Disease Control and Prevention reports, and we're going to break down the issues. So again, I want to thank everyone for sending me emails already at ejb678@gmail.com, and please do. And guess what? We are on iTunes. I need to say this again: iTunes, Spotify, and Podbean. So please subscribe to us. That provides us more listeners. And Instagram me, and Facebook me, and do all the social media, because we're out there. But we're officially on iTunes, so you can listen to me anywhere. Listen to our show, and because this is the only show that's doing this out there in the podcast universe, that's breaking down the health disparity issues, particularly the ethnic health disparities issues. This is 2019, and we're going to be in 2020 pretty soon, and this is desperately needed. So this is what I'm doing every week. Yes, producing these shows, cause it's about time. I teach my classes, but I can only go so far. Now I can break down the issues much, much further. Hello. And this is what I really love to do. So again, and for this show number 6, we are analyzing the CDC report, Health Disparities and Inequalities report, United States 2011. Very significant. And again, I think we covered all the bases. And let me just give you the backdrop of this. The report articles were these articles, which is a supplement to the Mortality Morbidity Weekly report, addresses disparities in healthcare access, exposure to environmental hazards, and so forth. There's 22 topics included in this report. And this show will concentrate on environmental hazards. Show number 5 reviewed the social determinants of health. This show number 6 will highlight the environmental hazards. The information provided in CDC Health Disparities and Inequalities Report United States 2011 is of vital importance in achieving the goals of the National Partnership for Action to End Health Disparities. Hello. The report advances the objectives of the National Partnership for Action by providing additional scientific support for efforts to implement policies, programs, and professional best practices and individual actions that might reduce disparities in the shortest time frame. CDC's report complements, but does not duplicate, the content of the annual National Healthcare Disparities Report and periodic reports on health disparities objectives being monitored throughout the Healthy People 2020 planning and evaluation process. So again, this is very important. And let me just get the key point to this report is that they're providing this data, and here's what they actually say: analyzing and reporting the recent trends and ongoing variations in health disparities and inequalities and selected social and health indicators are important steps in encouraging actions and facilitating accountability. Wow. So we're holding agencies accountable. They said that's what it said. We can hold CDC accountable. We can hold every federal government agency accountable in their efforts to reduce disparities. And so we're analyzing their reports and seeing if they're accountable. We can do this in the United States, but unfortunately, the average citizen is not paying attention to this. I'm going to make sure each and every one of us pay attention to these issues. So we're holding, that's why, we're holding the federal government accountable and every institution accountable. That's their job. We pay our taxes. We can do this. So now, 5 minutes in, 6 minutes in, let's go to their statements, their analysis on environmental hazards. Okay, last show we looked at social determinants of health. Now let's look at environmental hazards. Hello. And there's two subsections to environmental hazards that they put in this summary report. One is inadequate and unhealthy housing. That's number one. And two, unhealthy air quality. United States 2009. So there's inadequate, unhealthy housing and unhealthy air quality that they identify in their summary. So what is this about? Now basically it starts off with inadequate, unhealthy housing. I'll get it out. They state homes' lack of structural and safety features can increase risk for injuries, elevate blood lead levels, and exacerbate other conditions, while poor indoor air quality contributes to cancers, cardiovascular disease, and asthma. The analysis of data collected from the American Housing Survey found that proportion of unhealthy housing units decreased from 2007 to 2009. Among housing units classified as unhealthy, the magnitude of disparities decreased across racial and ethnic, income, and educational level categories. The disparity by race and ethnicity, social economic standing, disability status, and education level, however, here this is a big however, is still substantial. Non-Hispanic blacks had the highest percentage of householders living in inadequate, unhealthy housing, followed by Hispanics and American Indian Alaska Natives. Let me say this again. Here's the key point. They just try to put it in there and move on. The disparity by race and ethnicity, status, disability status, and education level, however, is still substantial. Oh, wow. Non-Hispanic blacks had the highest percentage of householders living in inadequate, unhealthy housing. Hello. It's substantial. There's no doubt about it. The data is there. They couldn't get around it. It's a fact. The highest percentage of householders living in inadequate, unhealthy housing are non-Hispanic blacks, followed by Hispanics and American Indian and Alaskan Natives. Hello. There you go. It's no wonder when you have non-Hispanic blacks, come on now, Hispanic, Latinos, and American Indian Alaskan Natives directly affect their health status by, unfortunately, living in inadequate and unhealthy housing situations, which exacerbates issues of risk for injuries, elevated blood lead levels, cardiovascular disease, asthma, and it contributes to certain cancers. So just by inadequate and unhealthy housing, non-Hispanic blacks, Hispanics, Latinos, American Indian, Alaska Natives have high risk and is substantial. This should not be tolerated in 2019. We know that there are situations in every city across the United States in which non-Hispanic blacks, Hispanics, Latinos, American and Alaska Natives are living in inadequate, unhealthy housing, particularly those that have high levels of lead in their piping. There are communities pleading, protesting. Hello, Flint, Michigan. Hello, Flint, Michigan. Hello, Flint, Michigan. Hello, every city in America with inadequate, unhealthy housing, in which they know it's there and they continue to provide housing, unhealthy, inadequate housing for non-Hispanic blacks, African Americans, Hispanic Latinos, American Indian, Alaska Natives. That's uncalled for. Yet here's the other portion of this report. According to the Surgeon General's call to action to promote healthy homes, effective interventions to prevent home hazards include improving ventilation, avoiding the use of wastewater systems to dispose of toxic chemicals, using integrated pest management, installing grab bars in showers, aiding handrails to stairs, installing working smoke and carbon monoxide detectors, and installing four-sided fences around pools. Excuse me. Wow. This according to the Surgeon General's call to action. Now, I do have a beef with the Surgeon General. So I'm not gonna waste my time talking about the Surgeon General's reports. Not gonna waste my time. No, it's not worth it. But and all of those suggestions are, I'm not going to give it any airplay because it's irrelevant. Hello. Just leave it alone. That's another show in itself. So again, there's inadequate, unhealthy housing. And then number 2, under environmental hazards, they highlight unhealthy air quality. United States 2009 said particulate matter and ozone have been well documented as air pollutants that can adversely affect health. Wow. Says for both pollutants, approximately half of these counties are in metropolitan statistical areas that are of 1 million population. Minority groups, here's the data, here's the findings. Minority groups, including Asians and Hispanics, were more likely to reside in these counties in comparison with non-Hispanic whites. Pollutant sources, which involves heavy traffic and other environmental hazards, often affect these areas. Hello. From 2006 and 2008, a total of 53 counties in the United States did not meet the standard for fine particulate matter. And during 2007 and 2009, a total of 201 counties did not meet the standard for ozone. So they say public health efforts, including promoting use of mass transit, reducing emissions, can help reduce population exposure to these pollutants. Wow, what a revelation. So, based upon their report, unhealthy air quality, minority groups are exposed to more of these pollutants in their environment, in their neighborhoods. That's not much of a revelation. So not only do minority groups, including Asians and Hispanics, live in unhealthy air quality, They also live, and I say they, I'm a part of it, but I'm just being as objective as possible. We live in inadequate and unhealthy housing. So not only air quality, but we have inadequate, unhealthy housing. And since we know this, it's well documented by CDC in this report. What the heck are our country doing about it? What the heck is our country, is our states, our cities, our towns, our townships, our neighborhoods? What are they doing? There are great examples across the United States that are improving housing, that are improving, changing out how people are living, moving them from hazardous living situations, inadequate housing, and poor air quality to better places. There are number of examples. In this report, I'm surprised that there's not specificity in this CDC report. That's what I'm talking about. They bring in the Surgeon General's report. I don't want to touch the Surgeon General. It's all policy with the Surgeon General. Provide specificity. Where are the great examples that are culturally competent, that are respectful to each and every community, that is working hard and working with each and every health disparity population? It doesn't take that much extra effort to include it into this report. This data is very important, folks. So, in this show number 6, we're looking at environmental health, and basically this report, the CDC report, states that inadequate and unhealthy housing exists. Unhealthy air quality exists, and unfortunately, minorities, as they say, non-Hispanic blacks, followed by Hispanics, Latinos, American Indians, Alaskan Natives, are exposed to inadequate housing, unhealthy housing, and unhealthy air quality. Wow. So what are they doing about it in 2019? Now is the time. We got the data. We can hold CDC and the federal governments accountable because the data is consistent. They document it. Environmental hazards are extremely important. They contribute to our health disparities just by where we live. What we breathe is unhealthy. Oh, let me just say this. Oh my gosh. Yes, I lived in Houston, Texas for 2 years and loved Houston, Texas. Loved it. But I realized also that the places that I lived were next to some hazardous companies producing all different types of chemicals. And that surprised me that an apartment complex can exist right next to a chemical plant. Right next to an oil refinery. Hello. So it existed back then, way back during the 80s when I lived in Houston, Texas, and it exists now in 2019. So this report is very relevant. That is, this report of CDC, Health Disparities and Inequalities report, highlighting number 2, environmental health issues and how it's connected to health disparities, is very relevant today. We can maintain, or we can definitely make federal government agencies accountable for helping the average citizen in making their lifestyle better. It's one thing to report the data. It's another thing to connect. And that's what I'm saying. Connect the average citizen and empower the average citizen to improve his or her health situation. We can do this in the United States. And don't forget, this is what I learned from the federal government. Guess what? The federal government belongs to each and every U.S. citizen. If you call your congressperson consistently, they will pay attention. They will move an initiative, move a bill, move a particular issue, and make it a priority. So don't forget, everyone, you, we are the government. The government is not this entity to itself. We are all a part of the government. We're all a part of the United States. And make federal agencies, make local agencies, make state agencies, make universities, make everyone accountable. There you go. Make them accountable. This is important. I think it's significantly important to go over these reports. This is about environmental hazards. We just covered inadequate and unhealthy housing and unhealthy air quality, contributing to our disparities, our health disparities, our ethnic health disparities. So we got more to go. It's important to break down the data. Thank you again. I'm 22 minutes in. This is the Ethnic Health Disparities podcast show. I am Dr. B. Send me an email at ejb678@gmail.com. And like the podcast, please like it. And hopefully you will subscribe. Thank you, everyone. Peace out. Peace out. Peace out, folks. See ya.